We're going to move on to our next speaker, who is Jason Davis, Dr. Jason Davis. He is at the Oak Ridge Institute for Science and Education. Most of you may know it as ORISE. And we have asked Jason to present some interesting material, which in a sense follows on very nicely from what we just heard from Dr. Devereaux. So without further ado, Jason, we'll turn the podium over to you.
Thank you very much, Dr. James. Thank you very much, Dr. Devereaux. I honestly don't think had we communicated in advance, I would have been able to get my presentation to align quite so effectively as it has with yours. As Dr. James mentioned, my name is Jason Davis. I'm a health physicist at the Radiation Emergency Assistance Center and Training Site. We're predominantly involved with large-scale radiological incidents, but we do maintain an interest in smaller radiation doses, long-term effects, and a broad array of public health and disaster response topics. In addition to the disclosure for the society, I also have to give a disclosure on behalf of REACT so we can maintain our accreditation by saying that I do not have any relevant commercial interest with any of the things that are going to be discussed in this presentation. And my own personal disclosure, I am not a physician. I'm a physicist. So the information I provide here shouldn't be used as a substitute for advice of an appropriately qualified physician or healthcare provider. This is going to be just for informational purposes. If we can set the anthropogenic versus cyclical climate change debate aside, and yes, believe it or not, there are still people debating this. If we were to ask a dozen different researchers for an example of a human health impact from climate change, you'd likely get a dozen different answers. Some effects are obvious, like the health impacts of heat waves. A couple of years ago, I was in the Czech Republic where they were experiencing the warmest summer on record. And a fair number of the towns in the Czech Republic have no air conditioning or ways for people to find relief from these heat waves. People might also talk about other extreme weather events like Dr. Cordero talking about the hurricanes, or food insecurity resulting from variations in rainfall patterns. Now, the images up on the screen are to show the drop in a water level of the Paraná River in Rosario, Argentina over the span of just about 1 year. It's a false color image, but it shows just how striking an impact changes in rainfall can have on a body of water that's used for the livelihood and health of hundreds of thousands of individuals. Now, some effects from climate change aren't as intuitive, like the variations in vector-borne diseases or food and waterborne infections. And still others, like mental health effects, can be even more difficult to attribute to one particular cause, but a correlation is strikingly evident after any one of these large-scale climate change-related events. When I was asked to describe the impacts of climate change on radiation safety and health, I was tempted to focus on the catastrophic events made possible by sea level rise. A large portion of our nuclear power plants sit close to coastlines because of their need for large quantities of water to cool the reactors. It's tempting to think about the Tohoku earthquake and speculate on whether storm surges and rising sea levels would lead to future incidents of this magnitude. I was also tempted to focus on the number of power reactors that had to go offline just last year in France as droughts and high surface water temperatures jeopardized the ability of these reactors to cool their cores. It was tempting to think about whether pulling these reactors offline would lead to the possibility of large-scale failures. But rather than traveling the path of speculation, I instead opted to evaluate factors that we can observe in real time factors that are currently leading to increases in human radiation doses. A climate change effect that's observable over comparatively short timelines is the increase in both the number and intensity of wildfires. As Dr. Devereaux explained, the particulates generated by wildfire can impose a direct impact on human health. And from that, it stands to reason that an increase in the number and intensity of these fires will have a proportionately greater impact. Just 5 years ago here in East Tennessee, we had a catastrophic wildfire, not only large loss of life, but actually changed the air quality at my house, which is over 100 kilometers away from the wildfire event itself. We don't think about wildfires in an area like East Tennessee because East Tennessee gets on average 51 inches of rain a year. But we were suffering from the second warmest summer on record and had received absolutely no rain between July 5th and the Thanksgiving holiday. And we can look through the literature and see that areas impacted by wildfires have already been linked with a higher frequency of asthma and other respiratory ailments. What many people may not know or may underestimate is the potential radiological impact of these fires. The combustion of biomass can liberate radioactive materials that have either been deposited on or incorporated into plant matter. The amount of material that becomes airborne depends on a number of factors, including the moisture content of the fuel, the heat of the fire, and the volatility of whatever the contaminants are. Now, with some notable exceptions, such as lichens, mosses, and even some mushrooms, transfer of most radioactive materials from soil to plant via the root uptake pathway is pretty small. And that rate tends to decrease with increasing atomic number, so that the heavier isotopes like uranium and plutonium generally aren't taken up much. But the radionuclides that do get incorporated into the biomass can be released to the air and concentrated in ash and particulates as the plant matter burns. Some of the more volatile radionuclides like iodine, cesium, and strontium can also be liberated from the soil as fire temperatures exceed the boiling point for each of these elements. Now, it would be reasonable for everyone to immediately jump to the risk of wildfires on land that's previously been contaminated as a result of weapons or power research, or as a result of large-scale radiological disasters. And this has been evaluated. The resuspension of environmental radioactivity has been measured during both controlled burns and wildfires on previously contaminated land. Air and soil samples taken in Northern Europe and in the woods around Pripyat, Ukraine during the wildfires in 2015 and 2020 primarily focused on determining how much of the cesium deposited after the Chernobyl disaster will become resuspended. The concentrations measured tended to be far less than the limits for occupational exposures to radionuclides, and the highest measured airborne contamination rates corresponded to a maximum committed effective dose of just over 1 nanosievert for a hypothetical individual that was sitting there breathing smoke for approximately 24 hours. It's a very, very minor dose. Now, air samples collected during controlled burns and active wildfires at United States Department of Energy National Labs confirmed the findings of the Ukrainian fires. They confirmed that the risk to firefighters or offsite residents from resuspended cesium and larger elements was found to be minimal. What really surprised the researchers was the activity levels of naturally occurring radioactive materials in the analyzed smoke. Particularly striking were the activity levels of polonium, which when I say that word, most people immediately think Litvinenko, and bismuth. Measured concentrations of these elements in smoke resulting from wildfire and biomass burning could lead to an intake of up to about 1.5 becquerels per day. For comparison, the normal daily intake from food and breathing is about 37 to 370 millibecquerels per day for a European diet, or as high as 480 to 690 millibecquerels for someone with a very seafood-rich diet. Now, this 1.5 becquerels per day would lead to a committed dose approaching or exceeding 5 microsieverts per day to those working or living in the areas of densest smoke. This is about the same dose from polonium that one would receive from sitting down and smoking 25 to 30 cigarettes. The polonium's there naturally in most soils. It derives from radon-222, a noble volatile gas. It's left over from naturally occurring uranium-238. And with a half-life of about 3.8 days, radon decays to a series of short-lived daughters. These short-lived daughters will end up in various states of equilibrium as they go up through the atmosphere. And actually, the smaller isotopes, the shorter-lived ones like lead and polonium, will adsorb to very small particulates. What was interesting from the research was finding out that we tend to think of radionuclides adsorbing to larger particulates, but the polonium and leads seem to show a preferential deposition on 0.1 micron particulates. These factors can lead to elevated contamination in plant matter in areas that have naturally high levels of phosphorus in the soil, or areas that have been fertilized with phosphorus-based treatments. So as wildfires start to become more of the norm and start to come to areas that have been treated with fertilizers, the possibility of this radionuclide entering the air and entering our lungs becomes more extreme. Plant matter from areas surrounding coal-fired power plants also exhibit elevated polonium levels when compared to plants collected far away from these power plants. And as the climate shifts, we really expect to see more power plants being built and more fuel being consumed, such that this amount is going to go up. Now, there's an entire spectrum of radiation-induced effects that can be observed at different dose levels. And most of us think about the large acute doses, like what was received by cancer therapy patients or atomic bomb survivors. The presence and magnitude of low-dose effects is less clear. But if we look at all of the epidemiology from former Department of Energy workers and miners and things like that, if we were to look at all causes of mortality and morbidity in these populations, instead of just focusing on cancer, we would notice that the radiation related mortality would be about twice what we're estimating right now. Now, the presence of polonium in the blood can cause different effects depending on how long it stays in the blood and the amount of material in the blood. Several epidemiological studies have looked at some of these cohorts of former miners and Department of Energy workers and found that there is an excess relative risk due for certain cardiovascular and respiratory diseases, in addition to cancers, for individuals that work in these fields. Now, most of the studies haven't shown a statistically plausible risk, but these studies have had very small numbers of participants, and there have been some other complicating factors that may have skewed the dose. Of note from a radiation protection standpoint is how the doses were calculated. In general, the calculated doses used for these studies are calculated either to the entire body or to a total organ. The problem with this approach is that it doesn't account for how alpha particle emitting radionuclides like polonium deposit their energy. Because an alpha particle is so large and has a double positive charge, they can deposit tremendous amounts of energy in a very short distance, in effect, in the space of about 1 or 2 cells. And we take advantage of this ability for alpha particles to deal irreparable damage to 1 or 2 cells while sparing surrounding tissues when we use drugs like radium chloride to treat bone metastases. For polonium-210, essentially all of the energy emitted is deposited within less than 30 microns. If we take the average wall thickness of a human arteriole to be about 20 microns, with a lumen diameter of about 30 microns, that means that a small particle containing polonium could deliver a substantial dose to just a small segment of that arteriole while leaving surrounding tissues virtually untouched. But again, we tend to report dose by assuming that the energy is deposited homogeneously throughout the entire organ or tissue. In reality, if only 1 or 2 cells are impacted, it's unlikely that the damage will be noticeable. The cells will undergo apoptosis and nobody would be any wiser. But as the concentration of polonium in the blood increases, so does the likelihood that enough cells would be damaged to induce an inflammatory response, lead to the induction of fibroses, or enhance vascular permeability, leading to multiple organ failure. Now, we are looking at some of these effects. We're looking at trying to understand the dosimetry better, understand the behavior of these very small particles, and evaluate the relative contribution from polonium versus some of the other irritants and toxicants within this smoke and particulates from biomass. And with that, I thank you all.
Thank you very much, Jason. That was really enlightening. I don't think most of it, at least I certainly was fairly unaware of much of the material, and I think it's very important material that you delivered.